Soanes. I'm Chief Nurse here at Teenage Cancer Trust.
So I guess our first question is, can you just tell us a bit more about like the role you do now and sort of what that involves?
So the role of Chief Nurse is really, really diverse actually and really exciting. So we, as a charity, fund and support over 100 nurses and youth support coordinators and MDT coordinators who work in the NHS with teenagers and young adults with cancer. So they're employed by the NHS, but my responsibility is to manage them to a certain degree to ensure that care and services are developed for teenagers and young adults so that they get the best access to treatment, care and support that they require. But as I said, they're independent, they work with the NHS and I sort of work alongside them to help them do that. I also work obviously inside the charity to give clinical advice, to work with colleagues who are leading on projects that will directly interface with young people with cancer. So our websites, our clinical information, some media and comms work, and also then I sort of network with other colleagues who are in similar roles, other charities who do similar work, and also international colleagues for nursing and allied healthcare professionals. So it's a really nice job, really diverse, really exciting.
So what does your typical like day-to-day look like?
At the moment, because we're a charity, we're not allowed to go into NHS trusts. Until recently, we were all working from home.
Yeah.
We're coming back into the office now, so that's great. But a lot of work is meetings, conversations, connections, networking on Teams and Zoom. But that's, a lot of people are doing that. So that could be meetings. I had a meeting this afternoon with the lead nurses who are working in trusts to support teenagers and young adults with cancer.
Yeah.
We're also planning to run an international global congress in December. So I had a meeting with the project manager to see how the congress was going. I had a conversation with our director of finance and operations. So a lot of meetings that revolve around my work or wider pieces of work and connecting with other people. A lot of planning for the year and a lot of conversations about things that we could be doing to support young people. So some policy work as well. So it's been quite a diverse sort of week and a day, but that's fairly typical. It tends, and that's as I said at the beginning, it tends to chop and change. It's
definitely.
Speaking to a colleague, colleagues about the cancer strategy for children and young people that just been launched in Scotland. So it's been a really good day, but as I said, really diverse day.
So have you always wanted to like go into like cancer work, or is there something else you had in mind when you first started?
So the reason I got into cancer was when I first qualified as a children's nurse, I moved up to London and worked at St Bartholomew's Hospital, or Barts, and they had two wards. They had the general children's ward, and then upstairs with the children's cancer ward. So when I first qualified, my first job was on the general children's ward, but I did a couple of shifts up on the cancer ward and thought that was really interesting. So moved up there, and then since then, apart from time when I was a senior lecturer and a couple of years in a general ward at UCLH in London, I've always worked in children and young people's cancer. So no, it wasn't a plan, but it happened, and I'm really glad that it did, and it's been a great career doing it.
That sounds it. So like, what first inspired you to want to be a nurse? Is it like someone you had in mind, or is it just something you've always wanted to do?
Well, like most children, there are in my generation, there are pictures of me in nurse's uniform when I was small. I was about 2 or 3. Yeah. But I didn't plan to be a nurse. Again, it was one of those sort of things that happened by default, by accident, really. But I've been nursing for over 30 years, so I must like it, otherwise I wouldn't still be in it and doing it. So what inspired me to be a nurse is I trained to be a nursery nurse, and I really liked. So I did that, and I really liked my hospital placements. So I did a couple of placements, one on a children's ward and one on a neonatal unit, and I really enjoyed that work. So I decided to go and train as a children's nurse. And and when I trained, you could do children's nursing and adult nursing at the same time. So I did
Oh, okay.
both at the same time. So yeah, it was probably those 2 placements on working with the children and their families that inspired me to be a nurse.
So what do you think is like the hardest part about being a nurse, especially specifically with your like job role and stuff?
For me, it would be going back into practice, because it's just so totally different from when I was last in practice. So I'm comfortable in working with people and doing leadership role,
Yeah.
and sort of, I think if you put me in a ward, I'd be quite lost at the moment. I could make the beds and bath and look after babies and feed babies and talk to people, but I think just the equipment and the way that things have changed, I would have to go back and do a real back to nursing sort of course. So the fundamentals are always there as a nurse, that compassion, that ability to talk to people, and as I said, the fundamentals of nursing care. But yeah, for me, it would be, I'd have to have a lot of training.
So to sort of flip it on its head a bit, what do you think like the best part about being a nurse are? Or like what's the best part like nursing in general, I guess?
I think, again, I'm going to bring it back to the people. I think it's that connection to people in a difficult situation.
Yeah.
And having the ability to be part of a team, to be part of hopefully the solution of that situation, or if not, to make that situation as less difficult as you possibly can for children and their families. And that's obviously some, at times of great distress, that might not be possible, but it's that teamwork, it's that being a part, as I said, part of a team that is there to help people and to support young people, and also not only to sort of in that particular time, but to sort of help them develop and grow and move on and become the people that they intended or wanted to be.
Yeah.
I think the other thing about nursing, the things I've done, I would never, ever have thought were possible in nursing, the opportunities that it gives you, both professionally and personally. I don't know if there's many other professions that will enable you to do that, really. So yeah, I think it's a great opportunity. And I trained, I didn't do university training. I was old-fashioned hands-on the ward training. So so I think it's a great opportunity.
So is there like any piece of advice you wish you'd known as a student, or you'd want other students to know based on your experiences?
I did write that down. I'm going to have to look that up now. I think never be afraid to ask the question that's in your head. I think we've all stood there and thought, oh, I don't know. And I think just ask it, and just don't be afraid to ask those questions, because they're not. And we always quite often say, oh, this might be a stupid question. It's not. No question's stupid, because if you don't know, then that's not an issue. You ask questions to learn, and you should always do that throughout the whole of your life. I also think take time to sort of learn and to listen from your patients or your family or the families of your patients, because I think you can learn so much from listening and talking to them.
Yeah,
that's your experience. And I think sometimes people think that's not work, but it is work. But yeah, and also, again, take the opportunity. If somebody said, would you like to, then just say yes, because you don't know what that experience will lead to.
So is there anything you found difficult to like master, or a skill that you like took quite a while for you to master that you can think of?
Loads of things when I was training. I can't think what. I think the ability to finish things on time, which is probably a skill I'm still not brilliant at doing. I think I've passed most things first time. Well, we used to be assessed. I don't know if you guys still are. But I used to be assessed to do various clinical skills. So I passed most things first time. But yeah, I think it's not necessarily the actual skills of nursing. It's doing things in a certain time frame.
Yeah.
That I probably was a skill. And I think even more so now, because everyone's so much busier, there's so much more work to do. I think it's that time management stuff that I probably still need to work on.
Well, you've been there about it being busy on the ward and in like nursing. Is there anything you do for self-care?
I'd like to say running, but that's not going very, very well. What do I do for self-care? I think I've always looked to going out with friends. I love socializing with friends. And I think we've all missed doing that in the last sort of 20 months, but that's coming back, which is great. Yeah, so going out with friends, speaking to people. I like going to the cinema. I like going to film. I like going to theatre.
Yeah.
Probably eating a bit too much chocolate would also be part of the self-care.
So what's your favourite thing to eat then? You mentioned chocolate. Is there a dish in particular that
I think
you'd enjoy eating?
if I was being healthy or not eating too much chocolate, anything. I love fish. Anything with fish would be great. So I've just had 2 weeks away and had loads of fish. So yeah, a good fish dish would be, and if that's not on the menu, a really nice chicken Caesar salad.
Sounds lovely. So, if you weren't being a nurse, what do you think you'd be doing now? Like, was there another career option that you had in mind? Or had always been?
No, I was never one of those people that knew that I wanted to do. I would like to have done something around art. So kind of what I was thinking when I was sort of 16, 17, 18 was to go and work in an art gallery, but I didn't quite know.
Oh, really?
I didn't know what that would involve. I can't draw to save my life, so I don't know why I thought that.
Can you tell us an interesting fact about you that isn't nursing related or like healthcare related that you've been sharing?
I really struggled when I looked at this last night, really. I don't think I'm a particularly interesting person, really.
I always struggle to think of facts.
I bet you've got more interesting things to say than me. All I can think of is I met the Pope once and had tea with the Pope. That's all I can think of. It's probably the most interesting thing I've done that's not related to nursing or healthcare. Isn't it all? But I don't do any. I haven't got any special skills, or don't play the piano to grade 8 or speak 7 languages. So I'm sorry. That's what you're going to have to take that one.
No, it's okay. Don't worry. So, is there a time in your career that you can think of that like give you the most joy looking back?
Yeah, I think that if you look back on your career, and I'm sure you've got the same, there are moments in time when you think, you made a difference to a child or young person's life, and that can be even little things like. I often used to say to people, if you can get a 3-year-old to take the medicine which takes fat, I think as a children's nurse you understand that, but that ability to actually get that child who doesn't want to do it, it's going to be horrible. You don't want them to get upset. If you can do that without upsetting them or their parent or their carers, I think even that little thing is a real joy.
No,
I think
definitely.
that to me is part of the essence of children's nursing. I think latterly as I've got a lot older and I've seen young people who I nursed when they were very unwell at a very young age build their own careers and start. And I'm not following them or anything, but I'm just aware that from listening to other people or seeing things on social media how well they've done.
Yeah.
So it's that, people who, as I said, you've nursed who've been really unwell and are now, out there doing things, growing their careers, achieving what they wanted to achieve. So I think that's really great. That's a great joy. So it could be the little things.
Yeah, definitely.
You played a part in that young person, that little person in some cases becoming a really successful adult.
Oh. You might have already mentioned this briefly, but is there a moment that you think of that's like you're the most proud of, looking back?
Ooh.
It's like one moment in your mind that sticks out above all the others.
I think I'm proud of what I'm doing at the moment because I think that's great. But I also think I had the pleasure of working at the children's unit at the Royal Marsden, and I think I was I was matron there. So, and that was part of it, developing the services. And I think it was, it's a unique place. So I think my proudest moment is sort of being part of the development of the children's service and establishing the teenage and young adult unit at the Marsden.
Definitely. So thinking about nursing like children and young people with cancer, what do you think students can do to help prepare them for like placements around cancer units, etc.?
I'm sure people say this to you all the time with placements and things. I think just think about what you want to learn and what you want to get out of that placement. I don't know how long placements are these days, but I also think prepare yourself for what, because cancer is really, really rare, and some student nurses may have never come across anybody with cancer, let alone a child or a teenager with cancer. I think just do a bit of reading, and that's, you know, academic text, yeah, but I think also look at the information that's on websites like CRUK, Teenage Cancer Trust website, Young Lives versus Cancer, because there's a lot of information there, not only about the types of cancers, but also gives you a sense through the stories that young people tell on those websites about what the experience of cancer is like for children and young people. And I think that will just give you a little bit of a sense of a context of what that placement will be like. I think sometimes if you go into a cancer unit, you can get a little bit distracted by the drugs, the acronyms, the treatment, and absolutely, you learn that and you will be taught that and people will explain that to you. But just think about what it is you're there to do as a nurse, and other than obviously give direct care, but also think about what you can learn about the experience and what that means for children and young people and their families and carers, because I think that will help you get into that, embed into that. And I think it's a fascinating area of nursing. It changes, you know, it's constantly changing. There's always something new to learn. There's great innovation. So I think that if you go, you'll have a great placement.
Thinking again about placement in like oncology, what do you think we can do that would help like make a difference in our role as student nurses? Is there anything I can think of, like specifically
make a difference to the patients, to the I think when I was working alongside student nurses, I let them do as much as they wanted to do and were allowed to do within the scope of their practice and where they were in their training. But I think you can do most things, and you should be allowed, as I said, within those boundaries of safety, competency, what you want, and also how you feel about it, to do the care that you want to do. I mean, but yeah, I think also I would never underestimate the fundamental care of nursing. Giving mums and dads or other carers a break is hugely, because then you get time to spend alone with the children, you get to understand the side effects of their care, you get to understand the impact of their care having on that child, you get to look after that child in that context. And children with cancer are sick and have their own specific needs and their own specific care requirements. And I think if you can do that well, then, you know, there's the skills that you have with the rest of your nursing career. I think the things like central lines, you know, the understanding and the diversity of you that you all see and looking after a child or a young person with cancer, and the skills that will bring from nursing, from, you know, protecting the child from infection, to caring for the, you know, the oral care, the nutrition, the complexity of fluid management, you know, all those things, as well as sort of understanding the chemotherapy and the side effects, and as I said, also the impact on the child. It's all there on a haematology oncology ward. It will be, but you guys are essential to that part of the care. You're part of the team.
That's great, thank you. So we were just wondering, you've mentioned briefly about the charity. Can you go into a bit more detail about what specifically you do to help like the children and their families?
So Teenage Cancer Trust is a charity that supports teenagers from 13 to young adults up to the day before their 25th birthday. So we provide units that are age appropriate for teenagers and young adults. So they are designed with the young person in need. So they are bright, they have are high quality sort of, sofas and chairs. They don't look, and that's quite common in a children's ward, but less so in an adult ward. So they're sort of designed to meet the needs of a teenager and young adult. So you'll have pool tables, you'll have better televisions, have better Wi-Fi. So the environment is partly what we fund, but we also fund and support nurses who are there specifically to look after teenagers and young adults. So that's clinical nurse specialists, lead nurses who are there to work alongside those young people. The lead nurses help develop regional, national services, and to advocate for the needs of that community and that trust, regional, nation. We also support youth support coordinators who are there to do peer support, but also emotional support for teenagers and young adults with cancer. We also offer clinical information on our websites. We offer peer-to-peer events that should be face-to-face but are now online.
Yeah.
So that just enables young people, as they come towards the end of their treatment, to get and meet other young people who've been through a similar experience, and then they can have that peer-to-peer support. So it's called Find Your Sense of Tumour. So the conference is normally held face-to-face, but this year and last year we're holding them online. So yeah, it's that holistic care, but also we do a lot of policy and advocacy work to ensure that, teenagers and young adults are in the centre of cancer plans and strategies.
Fabulous. So as part of our awareness week, we're doing a scenario where we've got a teenager and they're going to have a tumour. I was wondering, where would your role fit into that scenario?
A teenager who's got a
brain tumour.
So our role as a charity, our role as a charity would be to provide support and information so that young person can find out. Our nurses who we support, or the nurses who we support, would meet that young person early in their diagnosis and work with that young person and their family throughout that young person's treatment journey to support the family, to ensure that they understand the care that they are giving. Some actually will give direct care, i.e. chemo, but also to work with other teams so that young person will get the care that they need from other healthcare professionals, nurses, allied healthcare professionals, social workers and things. So actually navigate, coordinate, advocate that young person's care. And again, up until our care is often given for 2 years after that young person's cancer treatment. So it's about supporting that young person reintegrate back into their life as and when they can, either during treatment or after treatment, or at a point when they've recovered from their therapy after treatment. So it's about that, offering that holistic package of care to that young person through predominantly our teenage and young adult cancer nurses, but also supported by the youth support coordinators and working alongside the lead nurses who would actually manage the service delivery. So that's our role. If a young person's got a brain tumour, then we'd obviously be working alongside other professionals like other cancer charities. And if you're looking at radiotherapy, again, that young person's care may be up and down the country. So it's about our nurses working as a network, so that if that young person has to go, say, to Manchester for some of their treatment, then our team or the team in Manchester would be able to pick that young person up. So it's got a continuous model of care wherever that young person goes around the country. They should always be connected to the local teenage and young adult cancer service, which we help support. So, that care should be seamless regardless of where that young person is. And then at the end of treatment, as I said, offering peer support, end of life, apologies, end of treatment support.
So we've mentioned quite a bit about what you do to support the child and stuff. Is there anything that you specifically do to help support families and siblings, especially if they might be younger siblings who don't really understand what's going on?
Yeah, so we have information on our website for families, but the nurses and youth support coordinators would always work along. it is, as it often is in children and young people's cancer care. It's a holistic model of care, so it's not just the young person, it would be the family. And in some cases, it's the care and support is more for the family. Sometimes, the family needs more support than the young person, which sounds a bit counterintuitive. Well, this. But so we would always work alongside the family and siblings as well to ensure not just to work alongside the siblings, but also recognizing that if the carers, parents or siblings need additional support, again, signposting them or bringing other colleagues into the team in to support those young people. But it's a holistic model of care. It's not, although the focus is the young person first, it's obviously people who work around them and supporting that young person. And that's various conversations. It's also ensuring that that, as I said, I picked up on that thing about the joy of young people sort of moving on. It's also helping that young person become independent and take on their own care needs as they go through survivorship and also working on that, and also supporting parents and carers who may find that transition to life after cancer difficult because their role slightly changes. So it's about working with the whole family and meeting those needs, and it's also about assessing those needs and working with people to identify their own needs and what support we can give.
So do you think that's the path been changing anyway because of the pandemic?
I think it's been delivered differently. Speaking to colleagues who are in practice, it's, as you guys know, it's a lot of Teams calls, a lot of Zoom calls. Young people who aren't able to have their parents stay with them because they're over 18. Nurses have had to do a lot of balancing about supporting the young person who's in hospital on their own, but also keeping the parent and carer or partner or significant others informed. So I also, and again, it's that is managing that communication and that connection when everyone's in PPE and you're restricted as to which rooms you can go and how long you can be in those rooms. So it's a completely different way of working, but I think the connection's still there. I know people have gone front and centre, and some of our youth support coordinators said it's almost easier to work on Zoom because you don't have to have your mask on and you can see people's faces but there are some young people who have never seen their carers without a face mask, so you don't get so it is very different, completely different. But some places are being able to do face-to-face stuff outside for people who are off treatment.
Right, okay,
so it's slowly coming back to what it was before COVID.
So you mentioned about some of the support and care being delivered over Teams and stuff. Do you think that's a way forward? Maybe we can't always get into the wards for whatever reason. Do you think it's shown it can happen? Or
I think for some young people it will be their preferred way of working. With healthcare professionals, because I don't, you don't always have to come in. It saves money, it saves time. Some young people, I think, will be nervous about coming back into hospitals for a while. We've heard that already. Other people are wanting to come back in and see people face to face. A lot quicker than So I think, and it's funny, isn't it? Because telehealth health medicine was the new thing, and of course all of a sudden it's just swept in. There was no alternative. So I think for some people who that way of working will fit better to them, absolutely, I think it will stay. But I think there's a lot of words about blended and hybrid models. There's hybrid models of working, and I think that will emerge over time. But it has to be what's right for the person. It has to fit them.
So going back to the pandemic, had it had any effect on any specific cancer treatments at all? Or you all managed to get the treatment everyone needs?
Largely, I think the first wave things changed, became different. As far as we're aware, cancer treatment has continued to be delivered.
Right, okay.
for children and young people. But yeah, again, it was different because appointments were on sometimes online. Parents and carers couldn't stay with some young people, others they could. And then there were benefits, you know, we knew young people who had their drugs delivered to them so they didn't have to come into hospital to get them. So yeah. But as far as we know, care has largely been given on time and as it should be.
That's great to hear. I imagine, I've never done a placement with like cancer or anything similar to that, but I imagine it's like quite upsetting at times to look after and like deal with that patient. How do you deal with like the sadness, I guess, that comes with the job?
It is sad. It can also be a really joyful place to work. It's, but you know, for a lot of chronic illnesses, sometimes, you know, end of life can be quite hard because you're working with a young person who's dying at an age where you don't. These days, it's unusual. It can, and that can be sad. And if you're only human, and sometimes you connect to patients, not on an overstepping for boundaries, but you just connect to patients, and sometimes that does make you sad. And I think you have to acknowledge that you're only human. You can't not acknowledge that. But you're there in a professional role. You learn to deal with it professionally and seek support informally. Colleagues are really, really supportive in those situations. You know, for significant events, there are debriefs and support groups and clinical supervision and things like that. But I think it's about, again, goes back to the team, supporting people, knowing who's struggling, knowing who's finding things difficult. But yeah, sometimes it can be sad, but you are dealing with young end of life care, or significant news that alters a young person's prognosis. It can be tough, but you're there to walk along, you're there to do to support people. But yeah, you are, as I said at the beginning, you're only human. So acknowledge don't feel, if you're feeling upset, don't hide it. Don't feel that you're the only person doing that, and just acknowledge it. And you know, if you need help and support, go and get it. We will understand it.
So I've sort of covered like everything like we needed to cover, but just to end with, it's like 5 words that you think sum up cancer, and then like 5 words that sum up nursing.
Oh my god. You should have sent me this one before. I think cancer nursing, I think is, I'm going to change it slightly. I think it's rewarding.
Yeah.
I think you grow through doing it. That's 5 words. You never stop learning.
Yeah.
And you meet some amazing people. I'm sorry, that's not 5 words, Lucy.
No, it's okay.
We do meet some amazing people. That'll do.
Yeah, no, definitely.
And nursing.
So the last thing I wanted to mention, like, because this is quite a long video for people to sit through and watch, if you had to take like anything away from the video, what's the one thing like you'd want them to take away from it?
Enjoy your career. Take every opportunity that comes your way. And if you go into cancer nursing, I don't think you'll regret it.
Fabulous. Thank you so much for agreeing to come and interview us.